Well, new tonight, we're learning the fentanyl crisis is becoming worse in our community than others on the West Coast. That's according to a new report from the Multnomah County Health Department detailing 6 years of this growing crisis. Brandon Thompson has been covering the fentanyl crisis for us for months. He has the key takeaways from that report in his live.
Well, Todd, one is that Multnomah County's overdose fatality rate continues to rise. That is as other communities on the West Coast seem to indicate from the data that they're starting to get a handle on their situation. The reaches of the fentanyl crisis.
I have just a lot of compassion for folks who are dealing with fentanyl addiction.
It impacts nearly every corner of Multnomah County. Cameron Witten has seen it firsthand.
I had a family member who dealt with fentanyl addiction for over a decade, and they're better now. And that took a long time, but it was worth it.
He founded the organization Brown Hope, hoping to address the racial disparities in Portland. The Multnomah County Health Department found black people are more than twice as likely to suffer from a fatal overdose from fentanyl than white people, and Native and Indigenous people are at 5 times greater risk.
We really need our neighbors here in Portland to pay attention, to advocate to our city, to donate to nonprofits who are serving these communities.
Data like this help us to tailor those interventions.
Banks points to different trainings and messaging programs the health department has began to help. The report also details how the problem has grown. In 2018, the first year of the report, 2 people were dying from a fatal fentanyl overdose each month. Last year, it was 36 people each month. So far, preliminary data in 2024 that is not a part of this report shows it has doubled to 73 people losing their life every month. In this graphic, the purple line shows Multnomah County, the green is King County, Washington, and blue is San Francisco. Multnomah County has surpassed both. In San Francisco, their fatality rate dropped in 2022 after a local emergency declaration.
When we spoke with their epidemiologist, they cited some emergency response work that they had done, similar to Multnomah County.
People are experiencing a loss of hope. And yet, what I do believe is that we can be there for folks and that we can turn this thing around.
So the report also showed that ages 34 to 44 were the most affected by the fentanyl crisis right now. And it also shows that men are dying at an increased rate than women. Now, this report was not a part of the 90-day fentanyl emergency, but the health department says they will use this data to guide the response moving forward now that the emergency has ended. Live at downtown Portland, Brandon Thompson, KOIN 6 News.
All right, Brandon, thank you.